Welcome to Integrated Medicine Perspective. I'm Dr. Wendy Liu. Gut microbiota has been a hot topic these days. Many people take probiotics to help grow a healthy gut microbiota. In April this year, the U.S. Food and Drug Administration approved the very first oral fecal transplant medication called VOST. Which is used to help prevent recurrent Clostridium difficile infections, short for C. diff infections. The phase 3 clinical trials of VOST was conducted among people with a history of recurrent C. diff infections. However, gut microbiota imbalances are not unique to C. diff infections. Many people can suffer from this disorder. For instance, those with chronic diarrhea or constipation, frequent use of antibiotics, and long-term use of acid-suppressing medications. So could those people also benefit from VOST? I will share my thoughts and experiences on how to achieve a healthy gut microbiota. The reason there's such a great interest in gut microbiota is because recent scientific findings reveal that our gut microbiota plays a critical role in our overall health. And this role includes multiple aspects of our health, such as digestion, nutrition, metabolism, immunity, mental health, well-being, sleep, and more. For instance, people who have been on antibiotic for a while may suffer from vitamin K deficiency because vitamin K metabolism depends on a healthy gut microbiota. Numerous studies have revealed connections between gut microbiota and the disease occurrences or even disease treatment response. The relationship between gut microbiota and conditions like obesity and diabetes has been extensively reported. So has the impact of gut microbiota on cancer treatment outcomes. So understandably, people take measures to modulate their gut microbiota when it comes to disease prevention and the treatment. So what constitutes a healthy gut microbiota? A lot remains unknown, but two features of a healthy gut microbiota are diversity and stability. Diversity refers well over 1,000 different microbial species, and the stability refers to very little changes and at the same time rapid speed of restoration to normalcy after disruption. Interventions to modulate gut microbiota can be categorized into two main ways, pharmaceutical and dietary intervention. Let's first talk about pharmaceutical intervention. The most common form is the supplementation of probiotics, which can be easily purchased in grocery stores and pharmacies. And then there is the aforementioned fecal transplant medication, VOST. The premise of these two interventions is that they can provide healthy microbial strains, which later on proliferate into a robust and diverse gut microbiota. The healthy gut microbiota then provides benefits mentioned earlier in terms of nutrition, metabolism, and immunity. It can also inhibit the growth of harmful bacteria such as C. diff. Typically, a day's probiotic mainly provides two types of bacteria, lactobacillus and bifidobacteria. It contains about 1 billion microbial strains expressed in colony-forming units. However, the fecal transplant medication VOST contains a greater diversity of bacteria, but in lower numbers, only around 30 million. Now let's put these numbers into perspective. Typically, our gut microbiota contains 30 to 40 trillion microorganisms. That is 1-to-1 ratio compared to the total number of cells in our body. Let's also compare the number of microorganisms in probiotics or fecal transplant medication to the amount of microorganisms we ingest each day. Each day, we ingest billions, if not trillions, microorganisms through our food and saliva. The amount of microorganisms in our diet is roughly the same number provided by a day's probiotic supplement. But if our diet contains fermented foods with live cultures, such as some yogurt and sauerkraut, the number of microorganisms will exceed the amount provided by probiotics. We actually obtain more microorganisms through our saliva. Each day we swallow 1,000 milliliter, that is 4 cups of saliva, which contains billions, if not trillions, of microorganisms. So on a daily basis, we ingest microorganisms in numbers that are hundreds to thousands times higher than that provided by probiotic or fecal transplant medication. But there is a big difference between oral microbiota and gut microbiota, despite the fact that we constantly introduce oral microbiota into the digestive system. That means our gut selects its microbiota to a very large extent by its environment. Its environment include saliva, gastric acid, biojuice, pancreatic juice, food, existing microbial community, and more. So the gut environment likely plays a much more determining role in terms of the final formation of its microbiota. So I would argue modulating, adjusting the gut environment to make it suitable for the growth of a healthy gut microbiota will be a much more effective and accurate way for gut microbiota regulation, especially when dietary intervention is an available option for people who can eat. Now, this is a perfect time to shift the topic to dietary regulation for gut microbiota. Actually, the effects of diet on gut microbiota occurs rather rapidly, well within 24 hours. So what do we base on to adjust our diet for gut microbiota regulation? In other words, what is the physical sign of a healthy gut microbiota? That is the state of stool. Normal stools are well-formed, long, not too dry or hard, and easy to pass. I also often talk about the clean stools. What I mean by that is stools do not stick to the toilet, do not require multiple flushes to clean the toilet. Why emphasize on normal stool as the basis for gut microbiota regulation? That is because there's a strong correlation between stool consistency and the diversity and richness of gut microbiota. Many factors can affect stool consistency, with diet being a major one. Other factors such as emotion, sleep, exercise intensity, and frequency can also play important roles. I will focus on a few dietary factors that can help adjust stool consistency in a relatively effective and speedy manner. One being adequate water intake. Dehydration leads to dry stools. But some people may argue that they drink plenty of water, but their stools are still dry. Then the second factor comes into play, soluble fiber. Soluble fiber can help hold water, hold moisture in stool, because the soluble fiber has a very high water holding capacity. And because of that, they can be used to treat diarrhea. I talked about that in detail in my video on diarrhea. Additionally, a lot of soluble fiber is also fermentable, so they are great nutrition for gut bacteria. Soluble fiber-rich foods are whole grains, legumes, potatoes, and similar foods. The third important factor to regulate the stool consistency is the speed at which stools pass through the gut. When the stool transit time is too long, excessive water absorption can occur, and it leads to dry stool. When the stool transit time is too short, it may cause diarrhea. Vegetables play an important role in stool transit time regulation. When dealing with constipation, it is often necessary to increase vegetable intake. When dealing with diarrhea, the method, however, is not to avoid vegetable intake, but rather by adjusting vegetable selections and cooking method to help reduce diarrhea without compromised nutrient intake. In general, stool consistency can be regulated by a suitable amount of soluble fiber rich food and vegetables and a sufficient intake of water. These principles are practical for most people, but for people with certain food challenges, such as those with gastritis, colitis, irritable bowel syndrome, and more, individual help from specialists is needed. That's all for today's discussion. Please leave comments and questions. Thank you for watching. I will see you soon.